Hey everyone, welcome back to another episode here on Doctors Go Live. With me, I'm Nina Shahril Khan, your host for today. And today we are going to be talking about something which is quite personal for me. It is about busting HPV myths, the facts that could save lives. So, who is tuning in right now? Where are you guys tuning in from? And what is it that you guys want to learn in today's episode? That's what we're here to find out. Busting HPV myths to the facts that could save lives. Now, if you share this video out, you get to take part in our Doctors Go Live quiz happening right at the end after the Q&A, where you get to win some exciting prizes. And today we have Tiffin carriers up for grabs. So who wants to win? Let us know in the comments, okay? Now, all this is happening right here in Doctors Go Live with me, Nina, and our special guest for today, okay? So what are we talking about? We're talking about cervical cancer, which is one of the most preventable yet deadly cancers affecting women today, often because it goes undetected until it's rather too late. So many don't even know it's caused by the HPV virus. So the great news is that with the right protection, like an HPV vaccine and regular screenings, we can definitely significantly reduce the risk of cervical cancer and even eliminate it in the future. So that's what today's episode is about. We'll be joined by Dr. Chong Wen Kiat, Consultant Obstetrician and Gynecologist of Columbia Asia Hospital, Tebrau, where we're going to break down what cervical cancer and HPV is, how it spreads, who needs the vaccine, and debunk some common myths surrounding cervical cancer prevention. So, if you know anyone or someone who you think this information might be useful, or if you think this is such an important topic that everyone needs to learn, do share this video out, tag your friends, follow us on all our social pages because this episode is definitely going to make a difference. Now, let's take a look at this video.
Cervical cancer is one of the most preventable yet deadly cancers affecting women nowadays, often because it goes undetected until it's too late. Many don't even know it's caused by HPV virus. The great news is that with the right protection like HPV vaccines and regular pap smear screening, we can significantly reduce the risk of cervical cancer and eventually able to eliminate it in the future. I'm Dr. Chong Wen Kiat, Consultant Obstetrician and Gynecologist at Columbia Asia Hospital, Tebrau. Join me in the next episodes of Doctors Go Live, where we will break down what cervical cancer and HPV is, how it spreads, who needs the vaccine, and debunk some common myths surrounding the cervical cancer prevention. Happening on Wednesday, 7th May 2025 at 3 p.m. See you soon.
All right, welcome back. If you've just joined us, you are watching Doctors Go Live with me, Nina Shahril Khan. And of course, our a guest doctor for today, it was that very handsome guy who you'll meet very soon. Okay, and today we are going to be talking about busting HPV myths, the facts that could save lives. All right, so without further ado, please welcome Dr. Chong Wen Kiat, Consultant Obstetrician and Gynecologist from Columbia Asia Hospital, Tebrau. Doc,
Hello, Dina. Hello, hi everyone, and all
see,
the
very
viewers.
handsome. Hey, Doc, thank you so much for joining us today. We're very excited to find out more about this. Before we start, though, if you're tuning in right now, you have a chance of winning some amazing prizes in our quiz happening right at the end of the show. And today it's different carriers. So do ask some questions while we're at it. And if you have any questions, just write it down in the comment and we'll answer after the Q&A. And do pay attention to our very good-looking doctor here, okay? All right, Dr. Chong, before we start, right, can you share with us a little bit about yourself? How did you get started in medicine and what got you interested in women's health?
All right. Hello, everyone. I started my medical practice in 2010, and in gynae medical practice is about up to 13 years for now. Everything came very spontaneous because after the housemanship, I straight away posted in we call it ONG department. All right, so naturally and very spontaneous, I just follow the flow, and then I just become a specialist nowadays. Today, sorry.
Right. So it started from there. So and you know, when we were talking to you, one of the topics that you said you wanted to talk about was this. Why do you think it's important that we talk about we have this conversation about HPV and cervical cancer today?
Okay, my main focus today is basically to talk about HPV vaccines. It's actually very important in terms of a primary prevention of cervical cancer. So, because as a gynecologist, usually when the patients came, they already got the HPV infections, which is a bit too late, and probably it can lead to a serious complications like problems like cervical cancer. So, before you got this HPV infection, it is very important you got the vaccines. So if you already got the HPV infections, it's a bit sometimes it still help with some we call what we call the vaccines, but
Mm-hmm.
not that good already. Mm.
I see. Okay. So it's actually very preventable, and a lot of people don't know about this vaccine.
Right.
Okay.
So for the pickup for the vaccines is still quite considered low in Malaysia.
Oh,
Yeah.
wow. Okay, okay. So we're hoping that this episode is going to bust that. So make sure you share it out with all your friends, all right? Right. So without further ado, let's take a look at these slides, yeah? Okay. So, Doc, first things first, when we talk about HPV, what exactly is HPV? Or maybe we need to go into this. Could you share with us, Doc?
Okay, before we proceed, we need to know where is the cervix. Okay, as you can see, this is the anatomy of the female reproductive system. All right. This is the uterus. All right, and then uh, at the bottom part of the uterus is the cervix. It's actually a gateway in between the vagina and the uterus. So when you look at the point of vagina, this is how the cervix looks like. It looks like a donut shape. So yeah, this is the cervix. This is
Okay,
the
got it.
yeah.
Okay. So, what exactly is an HPV and how does it get transmitted? And how do you detect it actually?
Okay, HPV stands for human papilloma virus. This virus is quite special. It's actually a non-enveloped double-stranded DNA virus. What do you mean by that? Is this virus is like they got this characteristic that very difficult to get rid of it. You know, even though if you use any detergent, if you use any heat therapy, cold therapy, it's very difficult to get it from it, and it is highly transmissible. From skin to skin contact, also you can transmit, not only sexual intercourse. And also, there are more than 100 subtypes of this HPV virus. Most of them basically infect the genital tract in both not only men, not only women, but also in men. So in our population, about 50% of us probably will get infected with DHP at some point in our life. So as what I said, it's very difficult to get rid of it. Only with our good immune system, okay, we can
Mhm.
clear this virus. All right.
Okay.
So
So,
efforts have been. Right.
So that means 50% of people actually get it. It's a very common virus.
80% will get this HPV virus at some
Mhm.
points in your life. Yeah,
Okay.
it's like a very common, like a common cold like that. Yeah, so
Wow. Okay. Okay.
uh,
Okay. All right. So I guess the next question is, when does it get serious? But we'll transition into that. Yeah. So what about this one, doc?
okay, HPV, this virus is responsible for up to 99% of the cervical cancer cases. Okay, so
Okay.
yeah, so if you got the HPV virus, you are very, very high chance to have uh, progress to cervical cancer. It depends on the HPV type. Some HPV type there will be what we call the oncogenic property. So if you got a certain types of HPV, you got a higher risk of cervical cancer. Not all the types are responsible, but there are certain types of it. Okay.
I
Also,
see.
HPV, there are certain types also can cause vaginal cancer, genital warts, vulva cancer. Vulva basically is the outer layer of outer skin of the what we call female genital tract. Also, and then
Okay.
90% of the anal cancer.
Okay. Got it. So how do you detect the HPV, or the cancer? I guess.
Okay, as you can see, I think most of our women also do experience pap smear test before. Okay, basically we use a dilator to open up the vagina and look at the cervix. Okay, this is the cervix, the donut shape. Basically, you can see this pinpoint hole. This is called endocervix, the inner layer of inner part of the cervix, and there will be a outer part of the cervix is called as ectocervix. In between of it is called as transformation zone. This is the zone whereby we take the sample from the pap smear, because this is the area that undergo a process called squamous metaplasia, and it's very vulnerable place that HPV likes and then go and cause some problem and cause some abnormality there. So this is the area whereby we take the sample and then we send to the lab.
Okay. Got it. And what can you tell us more about the cervical cancer?
Okay, as what cancer name is actually abnormal grow out of the control of the cells in the cervix. So in Malaysia, cervical cancer is considered the third most common cancer among the women in their lifetime. So every day, about 5 cervical cancer cases are diagnosed, and about 2 women die due to cervical cancer. As what we mentioned earlier, 99% of the cervical cancer are related to HPV virus. So also, but with all the awareness and with all the HPV vaccinations and primary prevention and early detection, so we can see that there will be a decline in the cervical cancer rate from about 7 over 100,000 women. We can now reduce to 6 over 100,000 women. So now with this vaccination and all this what we call awareness, probably we can reduce further in future.
Okay, so the numbers are going down, lah. Yeah.
Right.
Okay. So what are the symptoms? How do we know we have it? Are there any common symptoms, or it goes largely undetected?
Okay. If let's say you are at pre-cancer stage, most of the women will have no symptoms. If let's say
Mm,
you have symptoms, probably is at quite a late stage already. So what are the what we call typical symptoms? Basically, you have any abnormal vaginal bleeding, especially after the sexual intercourse. Okay, we call post-coital bleed. Okay, this is quite a typical for cervical cancer. So, and then if let's say if you any unusual vagina foul smelling discharge or any pain during sexual intercourse, probably this is one of the signs that probably you need to take note.
okay. So it's really hard to know, right? Because it's like it's very
Yeah,
subtle. Yeah. And this is only when it's serious, right?
correct. So that's why, yeah.
Yeah, so that's why it's important to. But we'll talk about that in a bit. Yeah. So how does it develop actually? The cancer.
Okay, we need to catch the pre-cancer stage or before it become cancer, so that we can actually treat it early. All right. So because HPV infection can actually stay in our body for quite some time, can be up to 10 to 15 years. All right. We call it persistent HPV infection. So only it will cause some problem. So this is the progression from normal until we call pre-cancer stage like CIN1, CIN2, CIN3. Then it takes about 10 to 15 years to become cancer. That's why the screening is very important.
Okay, got it. So, what do we do if we have the symptoms? Before we go into the other, if we have symptoms, what do we do? What practical advice would you give to someone who suspects they or their loved one might have cervical cancer?
Okay, my advice is don't wait until you have symptoms because 70 to 80% of pre-cancer stage do not have any symptoms at all. At all, you still have a normal, regular menses. The only
Mm-hmm.
advice is go for routine screening. Okay,
Routine
do
screening.
a
Okay.
routine pap smear. Go for HPV vaccination. These are the main what we call that prevention. All right. If let's say you wait until you got symptoms, only go to seek medical attention, then probably it's at quite at the late stage already. Yeah. But
Okay.
if you do
Got it.
have any symptoms, yeah, just go and seek medical attention.
Okay. And let's say it's confirmed that I have cervical cancer. How do you treat it? What treatment options do you normally recommend? And in the cases you work for, do they get to recover successfully and fully? What's
All
the
right.
odds like? Yeah. So, first of all,
Okay.
treatment and then a recovery percentage, I guess.
Okay, so as you look at this slide, if let's say you are at the pre-cancer stage, like CIN1, 2, or even 3, you are not in
Mm-hmm.
a cancer yet. If let's say you seek treatment straight away, okay, so the we call 5-year survival rate is
Uh-huh.
very good, up to
Okay.
100%. Okay,
Wow.
recovered.
Okay. Okay.
Okay, so however, if you already diagnosed to have cervical cancer, it depends on the stage. Which stage are you? Stage 1, 2, 3, or 4? Stage 4 is the quite advanced stage. So basically, stage 1, the 5-year survival rate can go up to 90%. However, if you at the stage 4, which means advanced stage, like for example, it's already spread to other pelvic organs or spread to the lungs, probably your 5-year survival rate can be as low as 10 to 15%.
10 to 15%. Okay. And it's interesting that you said that the virus can stay in you for 10 to 15 years. So you actually and it takes 10 to 15 years before it becomes cancer? Was that right?
Correct?
Yeah.
Yes.
So you actually have a lot of time to do the checking and
Yes.
whatnot. Right? Yeah. Okay. Okay. Got it. And what treatment options do you suggest, like pre-cancer, stage 1, 3, 4? Yeah. Just so that we know.
Okay, for let's say for CIN 2 and 3, sometimes we just need to uh, remove what I mentioned just now, the transformation zone. All right, the
Mm-hmm.
area is good enough. Okay. However, for example, in if let's say you already diagnosed as cancer, all right, in stage 1, probably we have to remove because
Mm-hmm.
radical hysterectomy or just remove the entire of the cervix. It depends. It's very individualized. Okay.
Okay.
So if let's say you are at the advanced stage, probably it's not a good idea to what we call to proceed with the surgery. Okay. Sometimes probably you need to undergo chemotherapy or radiotherapy.
Okay, got it. And what about if it was pre-cancer? What would be the treatment be like?
Okay, as I mentioned, if let's say CIN 2 or 3, you can just remove the transformation zone. Okay,
Ah, okay.
there will be a few procedures, but the most common one we do is we call as large loop excision of the transformation zone. We call LLETZ.
Okay. The pre-cancer one?
Yeah, this is the
CINY?
pre-cancer. Yeah, this is the
Okay, got
pre-cancer.
it, got it. Okay, cool. All right. So I guess we can go to the next slide, right? So we talk a lot about prevention, right? We spoke about just now there's 10 to 15 years for the cancer to develop. Um, um, how can it be prevented? What do we need to do?
Okay. Of course, prevention is better than cure. So basically, HPV vaccine uh, is actually if for both females and males. All right, not only for females. Okay, why? Because this HPV virus most of the time is due to sexual contact. So if let's say the males also protected with HPV, then it will reduce the risk of females to get this infection as well. All right,
Mm-hmm.
but yeah. So as for other prevention like routine Pap smear and HPV DNA testing, uh, can be offered. Okay, for at the moment there is no approved screening available for males yet. Okay, so that's why. Otherwise, if you ask, is there if there is any prevention measures, like for example, to practice safe sex, like wearing a condom, okay, can reduce the risk. Also, like, yeah, these other measures that usually we need to think
Just
about.
out of curiosity, for the men, how would they know whether they have it, the HPV virus or not? Are there any symptoms?
um, Most of the men they do not have any symptoms. Okay.
That's
Yeah, I know
worse.
it's a bit unfair. It's a bit unfair. Yeah. So
Mhm.
that's why. But there's no because at the moment we don't know where to take the sample from for men to test for whether the man got HPV infection or not. Even though the and then also if the man got HPV virus, the risk of getting anal cancer, penile cancer is there, but it's very, very rare.
Right. Okay. So it doesn't really translate to cancer for them, lah.
Right. It's
Not
very,
it's
very
very
low.
rare. Okay, got it, got it, got it. Okay, so okay, so you suggest screening, vaccination, and of course, what about lifestyle, diet, and exercise? Does that play a role in preventing cancer, cervical cancer?
Okay,
More.
for diet, for lifestyles, basically we advise a healthy lifestyle, stop smoking if possible, to
Mm,
improve your immune system. As what I mentioned before,
mm,
basically if you've got a very good immune system,
mm,
this virus can actually just clear on its own. Okay,
mm.
so
Okay, okay.
yeah, so you
like like
just
like self mati lah, huh?
yeah,
Kind of like, I cannot survive. Okay, but if you eat bad food, it'll stay longer. Okay, all right.
yeah.
So let's take a look at the next slide. Are there different types of vaccines? Since we're talking about vaccines, how do they protect us, and how effective is it really? Because there's a lot of people who like like no, I got enough vaccine in me. So could you share with us, Doc, the different types of vaccines?
In the market nowadays, we basically got three types. We call
Mm-hmm.
bivalent, quadrivalent, or nivalent. So,
Mm-hmm.
as the names goes, for the bivalent means they only have two subtypes of HPV strains that can cover, like for example, 16 and 18. However, for quadrivalent, they cover four types of HPV virus. For nivalent, they cover nine types. Okay, so
Mm,
basically, nine types is got more coverage, lah, up to 90% can cover for the cervical cancer.
okay.
However, for the cervix, for the bivalent group, probably they only cover about 70% of the cervical cancer. Okay,
Okay.
so
Okay.
yeah, so that's why the more the cover, the better.
Okay.
Okay,
More cover, the better. But is there a difference in price? Just wondering. More
correct.
coverage. More.
Yeah, the
Is it a
price will
lot of difference?
uh, quite quite a lot different. Yeah.
Okay. Okay. And are there any side effects to the vaccines?
Okay, it's very rare to have this what we call allergic reaction or hypersensitivity reaction.
Mm-hmm.
Probably less than 5%. Okay,
Mm-hmm.
but usually it's just same like other injections like COVID vaccine like that. You could probably just have a local, swelling or tenderness for about past to 2 days, then it will resolve by its own.
Okay, got it. Okay, so could you share with us about the different? We already covered the types of vaccine, right? But the Malaysia HPV program.
Okay, I'm going to talk a bit about our Malaysian National HPV Immunization Program. It's
Mm-hmm.
basically first introduced in 2010, and it targets the 13 years old schoolgirls in public schools, and it's free of charge. So when you calculate 2010, when you are at about 13 years old, now today you are about 28 years old, correct?
Mm-hmm.
So yeah, so if let's say a woman come to my clinic and then at the age of 29 years old and above, probably she had already missed this chance of this HPV
Mm-hmm.
immunization. Okay, so and then so in 2010, after that, so the following year there will be a temporary suspension of this vaccine due to budget constraints lah. However, there will be a catch-up program again in 2012 for those who have missed the vaccines. And also in Malaysia, the national immunization program, they are still using bivalent. They only
Mm-hmm.
cover two strains at the moment for the HPV vaccine because of Cervarix, and they are in the transition to get the quadrivalent or hopefully can get Gardasil 9, the 9-valent as well.
I see. Okay, 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 got it. Um, in your opinion, because you probably see a lot of the data and you probably see a lot of women as well. Um, I think we're going to be talking about Gardasil 9. Gardasil 9, is that the but before that, sorry, let's go into the safety thing. What would you like to share about this slide here, Doc?
Okay, this vaccine is very safe because it does not contain any live, kill, or inactivated virus, which means if you got this vaccine, you won't get this virus. Okay, don't
Mhm.
worry. All right, and it's very safe, as I mentioned. It's only got a very minimal side effects. Okay, less
Okay.
than 1%, they do have all this hypersensitivity reaction. At the moment, it's still not recommended during pregnancy due to the insufficient data.
Okay, got it. So I think this answers the questions that I was asking before. Like, and what is Gardasil 9? Is that the 9, the one that covers a lot?
Yes, correct. So this is
Okay.
the vaccines that cover at the moment in the market that cover the most
Mm-hmm.
strains 6, 11, 16, 18, 31, 33, 45, 52, and 58. As for the 6 and 11, usually it is responsible to the genital warts. So for the 16, 18, and the following one is actually responsible for cervical cancer. Okay,
I see.
so it
Okay.
first introduced in Malaysia in 2017 for this Gardasil 9. So you may
Mm-hmm.
ask me, when is the correct timing to get this HPV vaccine?
Yeah,
So
actually.
basically, yeah, the before you have any sexually exposure, we call virgin, this is the highest efficacy. Okay, so up to 90%. However, if
Mm-hmm.
you already sexually active, whether can I still go to take this vaccine? Yes, can, but it's not as 90% protection like virgin already. It's about 70%. And even if for those who have HPV positive, like for example, I got HPV 31, okay, only one. So I still can go for it because I still need to cover for other types of the HPV as well. So the probably the coverage can go as high as 40%, about 17 to 40% like that.
I see. But okay, sorry. My logic would be if I take it when I'm older and maybe I have one of the virus, wouldn't it help as well? The
Yes,
vaccination?
definitely. Yeah,
Okay.
you still can consider, but not as high as those who do not have any HPV before or do not have any sexual intercourse before.
So then the question is it still useful for adults to get the vaccine if they missed it when they were younger? Like somebody who's
Definitely,
49 or something, still useful or not?
still
Didn't the
useful
number go down to 10%?
as long as you are still sexually active. It's still recommended for you to go for this vaccination.
Okay. Sounds good. Okay, so now, Doc, what are the myths and actual facts about HPV? Maybe you can share with us because some people might still be hesitant. Unless they're Malaysians, I think Malaysians love vaccines, right?
Okay, as I mentioned, HPV is so common. So that's why it's as common as a common cold. So that's why the myth is that if you take the vaccine, it's encourage you to have sexual intercourse, promiscuity, but it's not. It's false. HPV, due to the HPV that is so common and most people will come into contact with it at some point in their lives. So it is very important to get this HPV vaccine. It does not encourage promiscuity. Also, the myth is that will that cause infertility? No. This vaccine is very safe and does not affect any future fertility. Okay, if let's say I got the vaccine already, do I still need to go for routine pap smear screening? Yes, because routine pap smear is still very essential. We need to check the pap smear. Is there any abnormality over the cells, over the cervix, and then we can early detection, early treatment. So the myth is that this vaccine is new and unsafe. As I mentioned, this vaccine is already in the market for quite some time, over 15 years, and it has a very strong safety profile. So otherwise, is it only for females for this vaccine? It's false. Men can still get genital warts and HPV-related cancers. And basically, to vaccine the man is to help to reduce the transmission to the woman.
Okay, I think that's wonderful. That explains a lot. I have a question though, Doc. With the last myth, how come we don't vaccinate the boys as well? Because they, like you mentioned earlier, they are part of the problem, I guess. So
Oh
if
yeah,
we vaccinate both, then can it be like eliminated? Just wondering.
I think I have mentioned in my previous slide. So the
Mhm.
HPV vaccination is for both men and women. Okay,
Correct.
not only we vaccinate the women, but we also need to vaccinate the men as well.
Okay. But the free program is only for girls, right? Not for
Yes,
boys.
because of the budget.
Because of the budget. Okay. But it's the number 3 kilowatt of cancers, right? So I guess we can allocate more budget. But that's at the government level, I guess, right?
Yes,
Okay.
you can
Sounds good.
still always you can always go to the private and get the jab.
Okay, fantastic. In fact, I think that is one of the questions that the viewers are going to ask, but we will go into that during the Q&A, okay? So, Doc, if you were to summarize what we discussed today, what would be some of the important points that you want the audience to take home with respect to this topic?
Okay, my main focus today is to take the HPV vaccination, regardless whether you are still virgin or you already have a sexual intercourse. At any point in time, if you are still sexually active, go for this vaccination. All right, and then also men also is encouraged. Doesn't discriminate men or women. Men also need to go and vaccinate so that to protect the woman. All right.
Exactly.
So
So I think for all the progressive, feminists out there, send your boys as well. It's equally important in my opinion, lah. Okay. And what are the most common myth or misconceptions you hear? What is it that or what is the biggest mistakes in your experience? The most common mistakes or misconceptions that people make when it comes to this topic?
okay, basically, from my experience, they thought like if let's say I only have one sexual partner, I have been practicing safe sex. Do I still need to go for the HPV vaccines? The answer is yes, because as I mentioned, this HPV can stay in your body for quite some time. Okay, can be up to 15 to 20 years. Not because probably you got this HPV virus back in 15 or 20 years back. Now only it shows up. So it's just better for you to get the vaccination as early as possible. And even though you are a lawyer, only got one single partner, and then you what we call that you practice safe sex, but you still need to consider these HPV vaccines.
I see. I see. Okay. So if there's one thing that you want every person watching this episode to go with, what would it be?
Okay, go for these HPV vaccines if possible.
Okay, got it. So go for HPV vaccine if possible. Okay. So I guess now we can go into the Q&A. So are you ready, Doc?
All right.
Okay, cool. Let's go to the first one. And the first question is, you can actually see it at the bottom of the screen. Tan Q Sheng is asking, how frequent should we go for pap smear screening? And women of what age should start going for it? And maybe at what age you can stop as well.
If it basically we do encourage the woman to go for pap smear screening at the age of 25 years and above.
Okay.
Okay.
25
So,
years
for
old.
example, if you are at a high risk group, which means, for example, you are immunocompromised, you got any medical problems, chronic problems like diabetes, kidney problems, and then you have multiple sexual partners, probably you need to go early to get this pap smear screen. If not, then probably a 25 years old and above is as our cut-off age to go for this regular pap smear screening is okay. So how frequent do you need to do a pap smear screening? A lot of countries nowadays we use HPV DNA test as our primary screening tool. All right. If let's say you do the pap smear screening together with HPV DNA test, probably you don't need to have so regular screening. Probably 3 to 5 years is good enough.
3 to
Okay.
5 years. Wow. Okay. Okay. And you already answered the at what age. Is there a good number to stop doing a pap
25
smear?
years old and above.
No. Maximum age.
65.
65.
65.
Okay.
Yes.
Okay, got it. All right. Thank you so much. That is Tan Q-Sheng's question. Next is we're going to go to Fazia, which ties in with your question. For cervical cancer screening, can we do HPV DNA test alone?
Yes, you can actually do what we call, as I mentioned, you can still do a HPV DNA test alone. We call as a primary screening tool. Only if you have if your HPV DNA test is negative, is you do not have any HPV infection, then probably you don't need to what we call that proceed with pap smear screening.
I see. Okay, okay, that's good. So that test basically tells you whether you have HPV or not, right?
Correct.
Okay. And then you do a pap smear to see how serious it is, right?
Yes, yes. That's why now the trend is HPV. You can test the HPV. If let's say abnormal, or if let's say your HPV is detected, then only you can go to do the pap smear. It's okay.
It's okay. Okay, cool. I think that sounds good. Okay, so next question is from Jack. Jack Nicholas is asking, well, actually, it's just a statement. This might be explained later on, but HPV vaccines are usually given to women aged between 14 to 45. For ladies who are after 45, how do we go about them?
Okay, it depends, as I said, whether you are, you do not, if you have any medical problems, like for example, that causing you to have immunocompromise, okay, then probably you need a more frequent screening. If not, women at the age of 45 and above, then probably 5 yearly screening is good enough.
5 yearly screening is good, huh? Okay, okay, got it. Okay. And Yiki's question is, can all HPV related cancers be fully cured? That's a good one.
I cannot. I don't get the questions.
I think maybe she means not well. If you have HPV related cancer, depends on which stage. So we don't know.
Yes,
The
yes.
earlier it is, the more the chances of curing. That's what I understood. But if the person was vaccinated, can it all be fully cured?
Okay, vaccination is not 100%. Okay,
Okay.
only what we call is the way of prevention. All right.
Okay.
So if you do have cancer, like for example, a patient come with me with a cervical cancer, okay, confirmed. So we do not go backward and test whether is she got any HPV already, right? We just treat the cancer itself, okay?
Okay, got it. So I guess the next question would be vaccination is for prevention, but are there people who actually get the cancer after being vaccinated? Like how many percent? I'm just wondering.
Okay, if let's say you do have, if let's say you are virgin, let's say you
Mm,
are got this Gardasil 9, all right,
mm.
and when you do not have any sexually exposure, so you are cover up to 90%, okay, but you still have about 10% risk of getting cervical cancer, okay, but
Okay. Which
80% is
goes
very
back.
good. Yeah.
Okay. So it goes back to the number on the slide that you shared earlier, lah, right?
Right. Mm.
Right. Okay. Got it. So I hope that answers your question, Yiki. Yeah. Okay. So still have time. So let's go to the next one. Alvin Lam is asking, will we get it when age grows older? I think so because it takes 10 to 15 years, especially if you're not vaccinated, right?
Okay, from the data, it shows that the age from 45 to 55 years old, this is the age that usually we detected the HPV virus.
Wow. From how old again? 45?
40 to 50, 45 to 50.
45 to 50. Okay. Okay. So definitely answers your question. And then another question from Yiki, which is a very quick one, is cervical cancer hereditary?
No.
No, it's
Uh,
not.
yeah,
Because
99% is due to HPV.
99%. Yeah. I think this is one cancer that you can say is not hereditary. Yeah. Okay. This one I think is amazing news. Neural Kijah Ali is saying, I'm the one who survived from CIN3 post cone biopsy. Now she's happy she survived and she's saying, go and do screening, please. Yeah.
Okay, thank
All right.
you.
Yeah. So is that considered a very rare case to survive CIN?
CIN3 is a pre-cancerous stage. So as I
So
mentioned, if let's say you detected early, do not yet become cancer, then you treat the pre-cancer stage, then your what we call that your 5 year survival rate can go as high as 100%. So this is the what we call uh, uh, real patients lah.
okay, got it. So Gwen Yup is asking, if there's no sexual activity, does it mean we are safe from HPV infection?
No, you still can get HPV infection even though you do not have any sexual intercourse because it's very highly transmissible, probably skin to skin contact. All right, if you touch, also from mother to the baby, also you can get we call transmission, or we call as
Mm-hmm.
object, or we call format transmission. Like for
Mm-hmm.
example, if you share the towels, all right, you share the public toilet, sometimes you can get this also. But of course, still the sexual contact is, I mean, the sexual
The
intercourse is still
highest and
highest.
fastest spread, I guess, right?
Right.
Kind of thing. Okay, got it. Thank you, because I think that's a really good question, Gwen, and thank you for answering that. Yeah, Doc. We've got let's go for a few more. Eng WH is asking, may I know the price? Malaysian has to ask for price. I love this question. May I know the price for the vaccine and how much in the market right now for the different types of coverage? Yeah, doc?
I can just give you what we call a range. All
Uh-huh.
right. So it depends. If let's say in my hospital, we do have a package. All right. It's about roughly about 1,600 for 3 doses. Okay, this is our
Okay.
package. Okay, so of course, uh, the range can go as high as probably 700 to 800 per jet. So if let's say you require 3 injection, all right, can be up to 2,000. Okay,
Mm.
but in my hospital, Malaysia Hospital Tebrau, we currently have the package of about 1,600 for 3 injection.
So definitely you know where to go, kind of thing, right? Also, Doc, when you say that price, is that for the Gardasil or is that for the
Gardasil 9.
other one?
Gardasil
Sorry,
9.
Gardasil
Gardasil
9.
9,
Very
yeah.
good.
The 9
Okay,
valence. Yeah.
that's the one with the 10% non-survival rate, I think 90% success rate, sorry, kind of thing. Okay. And continuing from question, can the vaccine be taken at any private clinic or hospital?
Can.
Okay,
But it
obviously because
depends also.
Colombia is private, right?
Yeah, but it depends also. Probably you need to call a certain GP. Probably they don't keep the vaccine because you need to keep in the fridge. So yeah, so you need to ask the certain clinic whether is that available or not. Yeah.
Okay, got it. Okay, cool. Thank you so much for that. I think two more questions before we go to the quiz. Lakshmi's question is: if I've taken the Cervarix vaccine, do I need to take the Gardasil also, given that it's newer? Great question, Lakshmi.
It's optional, but we still recommend you to take the Gardasil 9 because it's cover the most types.
Okay, and it's quite a lot of difference, right?
Yeah,
The
yeah,
coverage. Yeah.
yes.
Okay. In terms of the percentage. Okay. So I guess that answers the question. And Paley's question is: if I've taken the vaccine 15 years ago, should I take the vaccine again? Somewhat similar answer, Doc.
Okay, if you have taken Gardasil 9, let's say about 10 or 15 years ago, you don't need to take anymore. Okay, it's only one time.
Okay, okay, okay. If you took the Gardasil.
If you take the Gardasil 9. But
Okay.
however, from the previous question, if you only take Cervarix or the Gardasil itself, the 4-valent, probably you need to
Mhm.
consider to take the
Agree.
Gardasil 9. But it's always an optional because the coverage also is not too bad. It's about 70 to 80%
Okay, okay.
already.
That sounds
Yeah.
good. But if you guys are still not clear, go and see your doctors, right? Kind of thing. Okay, so Nurul Kija, the one who was who had the results with the CIN3, she's asking if, let's say, I postpone biopsy procedure almost 2 years, when can I get pregnant and is it safe for me or any complication?
Okay, the cone biopsy is basically to remove part of your cervix. All right. So probably she got CIN2 or CIN3. All
Three
right.
just now. Mhm.
Oh yeah. So if let's say if she's mentally or physically prepared, she can straight away get pregnant. It's okay. Okay.
Mm.
However, there's still a risk, like for example, miscarriage. Okay, especially at the second trimester, cervical incompetence, which means your cervix cannot hold the pregnancy. Okay, because you already cut part of your cervix already. So sometimes the cervix is not strong enough to hold a pregnancy. So usually what we do is we will do a transvaginal scan to see your cervix, whether is it become shorter. And if it becomes shorter, probably we will do some intervention and then to support the pregnancy.
Okay, sounds good. All right. Okay. So now, I think let's take a break from the questions Q&A. We will go back to them, but first, let's go into our quiz. But what is it that you need to know in order to win? Well, first of all, as mentioned in the earlier part of the show, you have we have some Tiffin carriers up for grabs. But what you need to do to win? First, you got to be sure to share this video out at least 3 times, and remember to set the share post to public so that everybody can see it. Next, answer the 3 questions that we're going to be showing on the screen in a single comment, and you are on your way to win the prizes. So first, share this video out 3 times. Remember to set the post to public. Secondly, answer the 3 questions we will show. We will show on the screen in a single comment, and we will select the first 3 winners based on the correct answers and the shared post. So if you guys are ready, let me know. Let's go with the first question. So the first question is, cervical cancer is one of the most preventable cancers. True or false? Cervical cancer is one of the most preventable cancers. True or false? The second question is, the HPV vaccine is approved and recommended for both boys and girls. Is it true or false? The HPV vaccine is approved and recommended for both boys and girls. The third question is, only women can get infected with HPV. Is that true or false? Only women can get infected with HPV. Is that true or false? Now, while waiting to hear from who the winners are, let's go back into the Q&A, shall we? All right, we are going to go to I now. Okay. Let me see the question. Hang on. All right. So, hello, doctor. I am Ayn. If a patient is trying to conceive and her pap smear came back ASCUS, ASCUS, and HPV is negative, she could take her vaccine and to complete in 3 doses. Her question is, should we repeat the pap smear after the second dose or the third dose? And if it's negative, can she continue her treatment fertility?
Hello, basically, if let's say your HPV is negative, you're not to worry. So my advice is you still can go for the vaccine, all right? And whether or not you need to repeat the pap smear, my personal practice is basically you can straight away go back to your routine recall, which means that if you are not in a high risk groups, probably you can just repeat another pap smear again in about 3 years time.
Okay.
Yeah.
So hopefully that answers your question. That's a very good question. Yeah. Okay. So we've got another question from Ang Wen Jing Jane. If I already took Gardasil 9, do I still need to do a pap smear every year? I think you answered that, but let's just recap.
All right, you still need to do a pap smear because Gardasil 9 is only responsible up to 90% of cervical cancer. So they do have another few more types of HPV, high risk, we call oncogenic types of virus that this Gardasil 9 may not be covered. So my advice is you still need to go for a regular pap smear screening, but not every year. So if let's say your HPV DNA test is negative and you are not at a high risk group, probably you can just go for the pap smear about 3 to 5 yearly. It's good enough.
3 to 5 yearly. Okay, awesome. Okay, so Qixing has a question. If you already got the HPV vaccine, what's the lifetime coverage? Need to inject vaccine again? Men can also get vaccinated. I think you answered that, but let's hear it from you.
Okay, if they will take Gardasil 9, which is the most coverage in the market now, so you don't need to repeat anymore in your lifetime. Okay, so and then men is encouraged to get the vaccinated. One is to reduce the risk of getting man-related HPV cancer, and also to protect the woman.
Okay. Another question from Yiki, combined question. Can cervical cancer recur after treatment? And can HPV go away on its own, which you also answered, but let's hear it from you.
It depends on which stage are you. As I said, the pre-cancer stage, the what we call, if you complete the treatment and subsequently you do a regular follow-up with your gynecologist, then most of the time you can control the disease. Okay, so if let's say you already diagnosed to have cervical cancer, it depends on the stage also. Like for example, stage 1, then we straight away do what we call a complete treatment and surgical treatment. Then probably the risk of recur is quite low.
Okay, got it. And is it hereditary? No, sorry. Can it go away on its own? I think you said it can
Yeah,
if you're healthy, right?
yeah,
Okay, cool.
correct.
And the next question is from Tan Q Shing. We've got a few more. Is HPV vaccination compulsory for the girls under the KKM vaccination program? It is, right?
It is recommended, but if
Okay,
you,
so it's not compulsory.
yeah, but we encourage the what we call the girls to proceed with the uh, national vaccination program. Yeah.
Okay, got it. And Gwen Yap's question is, what's the difference between Pap smear and HPV DNA test? Again, it's a repeat test, but we'd like to hear it from you.
Okay, Pap smear is basically to detect if there is any abnormality of the cells in the cervix. HPV DNA test is basically to test do you have HPV virus. Okay, so both can be done together. All right.
Mm,
So
okay.
yeah, yeah. So if in certain country we use HPV DNA test, like in UK, we completely roll out to a HPV DNA test. We do not do Pap smear anymore. We straight away do HPV DNA test. If let's say you do not have any HPV infection, then probably you are not warranted to do any Pap smear.
Mm. Okay, but then if you have, and then you can go for the Pap smear, right?
If you have HPV, then
Mhm.
sometimes we do a procedure we call colposcopy. It's basically it's a procedure. Sometimes we can do in daycare. It's basically to get some sample over your cervix. Okay, a bigger sample and on call, especially sorry, if you've got this one, the high risk HPV, sometimes we need to take a much more accurate sample.
Potent
Okay,
test. Mm.
yeah, and then we send as a biopsy instead of just send a pap smear.
Okay, got it. So Gwen and Tan Kushing are all saying thank you so much for that clarification. Two more questions. Kushing is asking, the HPV vaccine is lifelong?
Yes, yes, life.
Lifelong. But if you got the older one, you might want to upgrade, right, Doc?
Right.
Right. Okay. And the last question from Ing WH. How about the women who use the measure cup during period and without sexual activities? Will affect it with the HPV virus? Good question. Doc, what do you have to say?
Okay. I think the measure to use the cup during your period, uh, it depends, but we do not encourage to use the cup. All right, probably because it depends. Okay, because sometimes if let's say your flow is too heavy, all right, sometimes it can what we call easily get infection. Okay, so frequent change pad is the recommended, and also if let's say you are not sexually active, but still because of this special characteristic of this HPV virus, it is so highly transmissible. So I still advise you to go for this vaccination.
Okay, got it. Thank you, Doc. That was very, very, very clear. Okay, so I'm afraid that's all the time we have for the Q&A, and we already have our winners. But before I announce who our winners are, let's take a look at the quiz questions again and find out what is the correct answer. Okay, so first things first, and Doc, you're going to help me with the right answer, right? So the first question is, cervical cancer is one of the most preventable cancers. True or false?
True.
Yes. Awesome. So the answer is true. And the next question is the HPV vaccine is approved and recommended for both boys and girls. True or false, Doc?
True.
Okay. And the last question is the HPV vaccine is only effective before someone becomes sexually active. Is that true or false?
False.
False. All right. So the answer is true, true, false, right, Doc?
Yes.
Yes, and the winners are Ara Devaharan. Nice to see you again after so long. Jago Jago and Choki Honey. I love your names. Jago Jago, Choki Honey. So congratulations to all our winners. So don't go anywhere. Please do check your inboxes because that is where we'll send you information about how you'll be getting your prizes. All right. So do check your inbox. So thank you so much for everyone for tuning in. Let us know what was the biggest thing that you learned today. For me, it was definitely about the vaccination that boys can also get vaccinated, and it'll help clear out most of the problem if both genders actually get the vaccination. And of course, if you get the earlier vaccination, you can always upgrade to the bigger one, kind of thing. All right, so those are the few things that I learned. But what did you learn? Let us know in the comment. But most of all, thank you so much, Doc, for all the knowledge that you shared with us today, because definitely going to make a difference out there. Yep. Let's give him a round of applause before we give thank you, right? Thank you, Doc. Okay. So thank you so much, Doc. So that's all the time we have for today. We hope you learned. And if you know someone who's really going to appreciate this information, especially if you have, that those tween kids and stuff like that, this is definitely a topic that, that they need to start looking into, right, Doc? Never too early to start. Yeah. And do share this video out and help some parents share it out, because it could be sensitive topic, who knows, right? But when you explain it scientifically, it's so much easier. So do share this video out, share tips, and you never know who it's going to make a difference to. So be sure to give us a like and lots of love while you're at it. That's all the time we have for today. Thank you so much. We'll see you in the next episode. Until then, thank you and take care of each other. Bye.